Welcome to our lecture series for the community. We're going to talk about a topic which a lot of us either have or know someone who has. So it's an important topic for various reasons. My name is Dr. Mahajan. I'm a board-certified internist. I've been practicing in Pinellas County for the last 30 years. So I shut my phone, and everyone please shut their phone, otherwise they're going to pay for all the food. All right, so everyone shut their phone on vibrator. All right, thank you. Please put it on vibrator, and so that way we can all get something out of this talk. We blocked all our time, so let's get something out. All right, good. So we've been doing it for 30 years, and we're very blessed. We, grew by word of mouth. And if you don't have a good-looking primary care, we can always take you or your loved one as a new patient. So why it's important? It's as you can see, in 2025, there are 38 million people going to have diabetes. Now that's about 12% of the population. So, that's why it's an important topic to know. So globally, again, it's a big player as well. Between age 20 to 79, 589 million, total population 39 million I just mentioned. Around 30 millions will have diagnosis of, which has not, they don't know about it. So that's about 9 million people don't know about it. And then if you do the math, 1 in 10 American has diabetes, and another close to 100 million Americans are pre-diabetic. So that's a big load on this country and world in general, the diabetes. And if you look at since 1990, it has quadrupled. And we'll talk about different factors which has done that. This is just a nice recap. We got 38 million people diabetic, 1 in 10, and 1 in 5 does not even know they're diabetic or pre-diabetic. So what are various types of diabetes? Out of these, the most important one is right here, which is 90 to 95% of the cases, and that's what applies to my practice, which is geriatric and internal medicine, so 16 and 18 and above. Mostly 65 and above, is what we are more specialized in, but we take younger people in their 50s. And so what's the difference between different types of diabetes? This we see mostly in young people, and it's autoimmune, and they need primarily insulin. They are very skinny, and we see in teenagers, and unfortunately they have serious complication in their 20s, 30s, and 40s. This is what in this room you'll be more interested in. The majority of the diabetes is type 2. And that's often linked with, we'll get into the factor, but the most important factor for causing it is insulin resistance, and that's caused by, inactivity, obesity, and our foods. And then the gestational diabetes, I don't think anyone has to worry about here unless you're not telling me something. Pre-diabetes is a very important topic. We'll touch on that. That's just a stage before diabetes. And there are other more rare variants which are up here, MODY, neonatal, LADA, but you don't need to worry about that. But if anyone on steroid, that we see a lot in a geriatric population, people who have rheumatoid arthritis, COPD, a lot of those conditions, they are on prednisone for a long period of time, and they get into type 2 diabetes. All right, so why we want to emphasize on diabetes? Because we can move the needle towards non-diabetes or pre-diabetes. That's how effective, if you follow these simple things on a regular basis, you can do that. There's no magic, you have to do hard choices, so we'll go through that. Anyone in this room diabetic? If they want to raise their hand, okay, 1, 2, 3, 4. So we got 4 people. Anyone pre-diabetic in this room? So 1. So, you can see this is the population. So, there's 1 in 10 who are diabetic, 1 in 5 don't know, or they're pre-diabetic. So this is the population right here. All right, so what are the various factors which cause diabetes? So if you can see excess body fat, especially the fat around the belly, has been linked with diabetes, and let me talk about insulin resistance a little bit. It's a little bit wonky concept, but it's very simple. So it's like, I put you in a dinghy and I push you in Gulf of Mexico and say, okay, fetch for yourself. So, you have food on the dinghy, but you have no water. I said, hey, water all around, why you need water? You said, Doc, you kidding me? This is a salty water, I can't drink. Same thing happened to the body. There is insulin all around our blood vessels in type 2 diabetes, but it's ineffective to push the sugar inside the cells. So that's called insulin resistance. And that's the main reason for us to get fat and needing more insulin. That insulin is ineffective, we throw in more insulin, and then we become more fat because insulin makes you eat more. So, that's a vicious cycle with diabetes. So how can we break that cycle? And we're going to talk about that. We are getting more and more car culture, suburbia culture. Everyone has a car. If you go to big cities like New York, people walk because they can't afford the parking. It's not that they can't afford the car, but the parking is so difficult. And in those bigger cities in US where they have mass transit and they walk to their transit, they have less diabetes. Same thing in Europe. You go to Europe, the bigger cities.
What's my excuse?
Say it again?
What's my excuse?
What's your excuse? You have a car.
I live in New York.
You lived in New York.
Yeah.
There are genetic factors too, and then, so it's a complex disease. I'm not just saying living in New York, will cure it. But yes.
Well, I walk for miles a day, and nothing ever gets better.
We'll hold on to that question. What's your name? Greg. So hold on to that question. We'll go through that and I'll come back to that. That's a very good question. I'll come back to that. So the lack of physical activity is definitely a factor which causes increased propensity for type 2 diabetes. Now, this is the most important piece in last 5 decades. Studies have shown has been linked with diabetes, which is processed and ultra-processed food. Why so? So if you think about it, in the morning, how many people eat cereal from the box here? Oh, good. So this is a occasion. So this is a smart crowd here. So most of the talks I go to in churches, I have more than half the people raise their hand. Why? Because it's easy. You take a box of Cheerio, you dump it in your bowl, you dump some milk, and and the Cheerio box says, oh, there's a superstar athlete up there, and his whole grain must be good. It's bullshit. Why? Because it's processed. So if you get nothing out of my talk, and if you can just remember one thing out of this talk, less processed food. And ultra-processed is even worse. So why so? There are two answers to that. One is the bigger answer, which you will see I'll keep coming back, which is lack of fiber. Fiber is the magic which prevents diabetes. There are various kinds of fiber. For simplicity's sake, we'll just call them soluble fiber and insoluble fiber. We'll come back to that when we talk about diet. But the processed food and ultra-processed food extract that fiber out. So that's the magical stuff which has been taken out. Why? It has been taken out so it cook quick. If you look at oatmeal, people say, oh, I eat oatmeal, I don't, do the cereal. I said, that's great. How do you make your oatmeal? Oh, I just, put it in the microwave and it's done in a few minutes. I said, that's cereal. That's processed. They took out the most important part from the oatmeal is the husk or the fiber. So anything which cooks quick, spit it out. As simple as that. If you just follow that rule, that anything which cooks quick, there's no fiber in that. They made it easy, but we pay a price for easy and convenience. So you go to a grocery store, most of the buy one, get one free deals are on that shits, the boxes, the bags. So anything which is made in a manufacturing plant, spit it out. Anything which comes from a plant, eat more. If you remember that rule, no matter whether you have heart disease, diabetes, pre-diabetes, history of stroke, fatty liver, everything will improve. Even your microbiome will improve. And microbiome, which is the bacteria or fungus and the yeast and the viruses in your gut, that has, now we're scratching the surface on that, that has been associated with good health, if the microbiome is healthy, or poor health, if it's unhealthy with processed and ultra-processed food. And if you eat more fiber-based diet, plant-based diet, you will have a healthy microbiome, you'll have better emotions. Believe it or not, you'll have better emotion, less depression. That's how powerful the microbiome is. There is a nerve which goes from your belly all the way through your heart to your brain. It's called vagus nerve. It carries all the chemicals, the neurochemical reaction the microbiome has, and it regulates your heart, it regulates your brain. That's how powerful that healthy microbiome is and for good health. So we'll come back to that. Let's go to the takeaway is the diet. We talked about that. Activity level, body weight, if we can reduce any of that and increase this and change the diet to the plant-based diet or less manufactured plant diet, you will see a difference. All right, so this is a food pyramid. On the top of the pyramid is what you should be consuming the most. You see the bottle of olive oil. Now, the minimally processed food is what you should be consuming. Now, they made a typo here. They put a soda up there. There should not be a soda. But anything in a box, we need to kick out of this picture. Anything which is without a box, which is in the raw form, all these things, that should be 3/4 of your plate, and we'll go towards that. And, and the fresh is better. Anything fresh is always good. Anything, fruit juices, anything, the cereal we talked about, chips, which are ultra processed, give it to the boyfriend, girlfriend you don't like. So, more you're going to do this, which is raw, more you will feel better. Think about, I'm not even talking diabetes, I'm just saying you will feel better. If the body is a temple, and if you give good offering to the temple, you will have good shit, literally. Because the number one reason patient come to me is not diabetes. They come to me, doc, I can't poop, in their 60s and 70s and 80s. Why? Same reason. There's not enough fiber in the diet. So if you give good offering with good fiber, you'll have good shit. So simple like that. All right, so how can you monitor your sugar? So there's different ways to monitor it. You've probably seen it all, done it all, or seen your loved one do it. There is finger stick method, and there's a newer method where you put a patch and it just do it for you. So that's very important. Why? You don't know what your number is? You will eat the soda, you'll eat the cookie, you'll eat the candy, you'll eat the pie. I don't get high sugars with that. But you eat a piece of pumpkin pie in the fall season, and then you have a CGM or a machine to check your sugar, and your sugar is 350, you'll spit it out. You won't do it next time. But you don't know? It tastes good. So,
I know that. You can't starve yourself either.
Oh no, I'm not saying starve. I'm going to come back to that. That's a good point he brings. Greg brought a very good point. Please do not skip meals. Very good. Thank you for bringing it. Skipping meals make you overeat. So eat 4 times a day, 3 times a day, 5 times a day, but eat sensibly. That's the key word here. No, not starving. No, sir. No starving here in my workshop. All right. So what can be done? So we talked about, before we go there, let me scare you a little bit. Why we need to get the diabetes under control? Diabetes affects you from head to toe. Let's start from the head. more strokes. Eyes, you get more retinal bleed, you get more blindness. Teeth, you lose your teeth, gingivitis, you get more infection of the teeth. You look at digestion, your gut motility slow down. You can't process the food. There is a nervous system which attaches to the gut that gets shot. Then you look at the circulation. We forgot the main organ here, the heart. The heart, you get blocked arteries. You get liver. You get fatty liver more so in those patients. And then you go down to your legs. You get poor circulation. You lose your feet. And you get ulcers which don't heal. And neuropathy which keeps you awake whole night. You look at head to toe. This disease is terrible. You don't want to wish on your enemies. So that's why it's important to have these things in your toolkit to do better with your diabetic management. So what are the key points? And I know it's a busy slide, and there's a lot of repetition, and there's by design. And this is not my picking this just because I don't like cereal, or I don't like processed food. This is all research driven. All these lines has a specific research which has shown this to be of value. So let's start from the top. My favorite diet, Mediterranean diet. Now, what's in the Mediterranean diet? Anyone wants to guess? Okay, yes.
Fresh fruit, vegetables, a lot of fish, and lean meats like turkey, chicken.
Why are you sitting here? You can take a talk. She's very good. So Mediterranean diet, why it's important? Every year there's a new diet. There is caveman diet, there is South Beach diet, there is carnivore diet, there is this diet, that diet. What studies have shown to help in preventing diabetes or reducing the diabetes or keeping it in control is Mediterranean diet. And not only Mediterranean diet helps you in that, it also helps reduce your strokes and heart attack. It also helps you with reducing your risk of dementia. Why? Insulin resistance. Insulin and high sugar cause inflammation in all the organs. If it's your brain, you get dementia. If it's your heart, you get blocked arteries. If it's your carotid arteries, you get strokes. So inflammation and high sugars and high insulin level, they all tied together with all the conditions. So the diabetes management not only touches on bringing your sugar down, it's good for reducing the inflammation out of your system. And the inflammation is the key we need to worry about. Excuse me. So let me just tell them it's the hospital. I'll call them in a minute. All right. So Mediterranean diet is not a difficult diet. It's very tasty if you think about it. Any diet which is going to be difficult, you can do it for a month, 2 months, 3 months, then you're going to not be able to keep up with it because, you're going to lose the weight. For example, Atkins diet. A lot of patients done that. They lost 30, 40 pounds on it, 3 to 6 months, and after that, they can't handle it. It's very difficult to maintain. It's a restricted diet. Mediterranean diet, you can sustain because what's in that? Fish. If you like fish, that's a good source of protein, and we're blessed to have, Gulf of Mexico in our backyard, so you can get fresh fish. A lot of veggies, and we're blessed in Florida to have, 365 days or mostly 365 days of sunshine and a lot of agriculture in local areas, so we can get fresh fruits and vegetables. Whole grains. Whole grains, again, keep you full, good source of protein, any kind of whole grains. For example, I'm a big fan of quinoa. The quinoa is called God's food in Latin America. There's a reason for that. It cooks easy. You can blend it with anything. You can blend it with salads. You can throw in your soups. You can throw in your stew. And it cooks in 10 minutes or less, like a rice. You put in a pot, put it for boil, 5 minutes later, it's done. And I store quinoa and brown rice in my refrigerator for me and my family. Why? I can alternate so I don't get bored. And that's a good staple for, a base on your plate. So whole grains of any kind. And then lean protein, she mentioned that, and then olive oil. Olive oil, avocado oil, mostly are shown to have good fat, which you need. Good fat, the brain is made of fat. You need good fat. The fat is not bad, it's the kind of fats. So if you follow that consistently, again, portion control. If you're heavy, you have, 5 servings of that, of course, not going to help. But if you're eating that and keeping the portion control, it will give you advantage from head to toe. More plant-based diet, we talked about that. One part of the plant-based is superfood is the nuts and the legumes and the beans. I was reading an article about a week ago about black beans, and I think it's going to be class effect that it just studied the black beans. Interestingly, black beans produces GLP-1 agonists, which is same thing as Ozempic and Mounjaro's. What's that? GLP-1 agonist is naturally produced in the gut and it gives you fullness and satiety. Try having black beans and brown rice for breakfast. Just for experiment. One day, instead of cereal, instead of whatever you eat in the breakfast, bacon, sausage, just have black beans and brown rice. I know she's making faces.
I don't like the beans, I like the rice.
Okay, we'll give you a substitute in a minute. Just for experiment, do that. You'll be full whole day. You won't be reaching for snacks. You won't be reaching for appetizers. Why? It keeps you full. The gut has a hard time to break the top layer of the black beans and brown rice. And the magic is, again, fiber. The magic is fiber in those two. But who said, we need to have cereal for breakfast? Who said that? TV, advertisements. Who's going to sell all those boxes? If you go to Publix, there's a whole aisle of cereals. They must be selling. Otherwise, they're not stupid. They have very smart people checking what people buy. So they must be buying that stuff over and over again for that aisle to be so big and so full. So you got to change your mindset about the food. You don't need to be regimented about it. Whatever is good, start your day with that. Breakfast is one of the most important meals. If we start our day well with good breakfast, the rest of the day will go well. So if you have a leftover fish, if you have leftover brown rice, if you have leftover lentil soup, put in all that, like chipotle. Quinoa. Whatever you have left over, who said that you cannot start your day that way? Put some olive oil on that, put some herbs on that. You'll be full whole day. It's like Ozempic. You took a shot of Ozempic in the morning. You got to think differently. You got to think differently if you want to achieve good results. Otherwise, whether you live in New York or Hawaii, you're going to be still not able to achieve the results. All right, let's see. We talked about less refined carbs, so the sugary drinks. A lot of patients come to me and I say, hey, your A1C, and we'll talk about A1C in a minute. It's the average sugar in 3 months. It's more than 8 or 9 or 10. What have you been eating? I don't eat sugar or sweets. I only eat diet soda. So what's the problem with diet soda? The diet soda, they say, it says 0 calorie. I said, okay. What happens after you drink the diet foods, or for example, the diabetic no sweet cakes or cookies or candies? What happened after that? Those sugar substitute, like aspartame, for example, they make you hungry. So yes, there's no sugar in that, but after you had the diet soda, what's going to happen? You're going to get hungry. Then you're going to eat more.
But isn't it harder to break down too?
Say it again?
Is it harder to break down?
You're right. There's a lot of other disadvantages of that. I'm just talking about the 0 calorie concept only. But you bring a good point. Those are, so any sugary drink, even diet, don't buy them. Because, the reason they sell make you feel good for 5 minutes. You know, you get that bubbly taste, you feel energized, you have caffeine in that, and they got that secret formula. People keep going back to that. So, you know, don't buy it. If you buy it, you can drink it. Just have water. Water in different forms. Put some ice in that, cut some lemon in that, cut some orange in that, cut some cucumber, make it a spa water, put some basil in that, whatever you have at home, you know, take a small piece and put in that. It will infuse subtle flavor, so then you can drink through the rest of the day. And make a big jug in the morning and keep pouring that for yourself. You don't need to buy bottled water. There's plastic, there's waste. You can have a filtered water at home, put some ice, and then put whatever you have. Grapefruit slices, squeeze some lime, you know, lemon, whatever you have. So, soda pop and juices, if you're drinking, if you have to take second lesson, we talked about, and we're going to have you check you on that, whether you're getting those key points. So the second point is no soda pop, no juices. Diet or no diet. All right, so, you know, you can count your carbs, and, you know, we can teach you if you're our patient with that. Jen is very good. She's our diabetic teacher here. And then, you know, physical activity. Now, the physical activity Greg mentioned physical activity. He walks all day long. But unless you make your body warm, the activity does not give you the metab improvement. You got to make the body warm. So how do you make the body warm? There was a big study on that about a couple of months ago. It's called a Japanese walk. It's a very simple concept. So if you have a phone or, you know, something like this, put a 5-minute timer on it. Every 5 minutes, it goes off. You go for a walk. Greg goes for a walk. Go for a walk on your normal pace, and the timer goes off. Now you go a little bit fast for another 5 minutes. So that's a brisk walk that you're raising your body temperature. You're improving your metab. And then timer goes off. You slow down again for 5 minutes. You do 6 cycles of that. Not a whole lot, 30 minutes at your own pace. Everything has a different pace to get their heart rate up, get their body temperature up. Studies have shown that's better than doing, you know, push-ups or high-intensity interval training or HIIT. Just in this room, I know there's limitation with arthritis, with back, with knees, with spine, but walking at your own pace is not a difficult thing. And then increase the pace for 5 minutes. So 6 cycles of that is called a Japanese walk. Slow walk, fast walk, slow walk, fast walk. 6 cycles. That's it. 5 days a week. It will pay you dividends. You'll have less arthritis. You'll have more energy for the rest of the day. An early morning walk is a better time to walk. You know, you see birds, you see nature, you see aha moments, and you know, you feel better, and the pollution is less too, so there's less cars on the road. So early morning walk, and if you have a pond or a beach or something nice, that also add to the calmness of the walk. So if you can do that, that's the third thing you can take from all these points I'm making, will change your life. If you do it consistently, you didn't get here overnight. So if you make 1 change, 2 change, 3 change, and stay with those. Stay with those for year after year. Even if you don't lose weight, you'll be better inside. You'll have less heart attacks, you'll have less diseases. All right, so we talked about then weight management, even 10% weight loss. So let's say, you know, I weigh, let's say for example, 180 pounds. Even if I can lose 2 pounds a month, that's about 24 pounds in a year. That's a manageable goal. If you even break down 2 pounds to even bite size every week, I'm looking at a half a pound a week, even quarter pound a week. So, you know, if you make it that way, instead of saying, you know, I need to get below 200 or I need to get below 150, he's paying for the food. Okay.
They got to be 100.
All right. So the weight management, just a small bite-sized target will make a big difference. A lot of people don't consider this to be an important part. To me, that's as important as exercising, is the stress reduction, sleeping. If you're not sleeping 6 hours, 8 hours, whatever, I'm not a stickler with whatever time. But as long as you're sleeping restful sleep with good REM cycle, you got to work on that. It's like anything else in life. You got to work on a good sleep if you're not a good sleeper. And as we get older, we have to take a leak. You have to, maybe get uncomfortable in certain position, may get too hot. Whatever it is, it's a challenge. But if you can get a good sleep, and there are tricks to do that, that will help you big time in reducing your sugar. Because lack of sleep causes you to be more stressed next day. More stress causes your adrenals to produce more cortisol, and you get more higher sugars. So it's a vicious cycle. And the medications, that's the last part. We'll get to that if you're, go to any physician, primary care, or clinic. But more importantly, if you do the other parts, you'll need less medications. There's definitely a role for medication. I'm not debating, this is not important, but this is why we have them all on the top and this we have at the bottom. There are different kinds of medication. There's new medication every day, but this is where the money is in the lifestyle. And then getting yourself checked regularly. We talked about A1C. It should be done every 3 months. If you're not in good control, if you're in good control, every 6 months is fine. Keep your lipids under check. There is something called Lp(a). If your lipids are good, you're still getting heart attacks and stroke, that could be the problem. Get that checked. And the LDL, the bad cholesterol, we need to get less than 70 in diabetic. So that's a much stricter guidelines because less risk of strokes and heart attack if you get the LDL or the bad cholesterol. Blood pressure, it's adding kerosene to the fire if you're diabetic. If you have high blood pressure and you're diabetic, now you have two things fighting to get you heart attack. There are two things getting you to get dementia. Believe it or not, long-term uncontrolled high blood pressure causes dementia. There are two things causing, God forbid, get a stroke. So keeping your pressure in control, keeping your kidney functions in good shape by hydrating yourself regularly, avoiding NSAIDs or Aleve, ibuprofen will help your kidneys. They will sing praises for you. All right, so we talked about plant-based diet. So if you can sit down, and there is a plate here, and if you can, Jen, can you pass me a plate? Thank you, please. All right, so if this is your dinner plate, right? Right. So if we can divide into 4 quarters, right? So 1, 2, 3, 4. If all this 3 quarters, you can make it plant-based, you can have freedom here. If anytime you sit down for any meal, you can make these 3 quarters plant-based, fiber-rich, you've done a good job. You don't need to think anything different. Other piece I'll add is color. On these 3 quarters, if you can have all the colors of the rainbow, for example, carrots for carotene or vitamin A, beets are phenomenal, they are antioxidant, tomatoes for lycopenes, any greens of any kind get you fiber and micronutrients. So if you have all the colors of the rainbow in these 3 quarters, you're doing a step above. And frozen vegetables are good. I know the economy is inflation and expensive. Frozen fruits are okay. Frozen is, they freeze it at the peak of their powers of the veggies and fruits. So if you can't afford, fresh is number 1. But if you can't afford fresh, frozen is okay. Canned food is number 3. Canned food has a lot of preservative, a lot of salt, and they dissolve the fiber. Anything, again, same concept. Anything cooked quicker, that means the fiber is gone. Canned food cook quicker, I understand you got to eat what you can afford. So if that's the case, then okay, canned food. But frozen is better. Just remember that. So if you remember this picture in your head, anytime you're sitting down, you will not go wrong. All the colors of the rainbow on the plate, plant-based diet is in the 3 quarters. 1 quarter, do whatever. So, people come to me, hey, I like meat. I said, okay, you got here. But don't go for second helping. You got here?
You think our food is in that quarter there?
Well, it's for you to pick.
Yeah. No, I mean, if we serve ourselves, how would you depict that quadrant?
The what we gave served today.
Yes.
So, you can serve whatever, and then you can go to grocery store and get whatever. It's your choice. You're getting the education. You pick the right thing. Don't eat anything. Just drink water and go home. And then, at home you have the liberty of picking whatever.
No, I think it's very healthy food.
Oh, no, it's healthy. What I'm saying is, if you go to a buffet or a restaurant or a, party, and they serve you Coke and cookies and, cake, just fill this piece and then rest of the piece you can go home and fill. But always have this picture in your head. If you have this picture in your head that I'm going to fill this piece at the party and we're going to fill that. Now, there are two other things which should, absolutely stay away. One is smoking. Anyone in this room smoke? So this is the same concept we just talked about. The 3/4 of the plate is, whole grains and veggies and beans and, onions and, all the colors of the rainbow. And the 1/4, grilled salmon, whatever of your choice. And then water, no soda, and then fruit could be on the side. So if you follow this consistently, you will have one less medication if you're taking a medication in diabetes in 6 months. Just by doing that. That's how powerful this piece of information is.
Now, what do you think of holistic teas and stuff?
So, if you make,
Old school stuff.
okay, tea is good, but question is, what kind of tea? If you have green tea and you infuse it yourself, yes.
With the, let's say,
If you have iced tea from Publix, I'm not sure.
the turmeric mixed with the onions and
Okay, good.
honey
As long as you're making it yourself.
you do it yourself.
You do it yourself, I'm good. If you're buying it from the store, remember what I told you. My first rule, which is the most important rule, Greg, is if it comes from a plant, spit it out. All right. So take home message. Let's put them all up there. I think I emphasized most of them. So it's very common disease. If you have it, it's not a shame that you're doing anything wrong. It's just, we live in this kind of culture where diabetes is knocking on the door. We have to not open the door. And we can change it. Big time we can change it on the principles I just taught on diet, activity, weight loss, and not smoking and consuming less alcohol. I didn't touch on alcohol. It's a touchy topic, but it's an important topic. Alcohol is pure sugar. Whichever shape and form you consume, wine, whiskey, whatever. Doesn't matter, it's $100 wine bottle or $5 wine bottle is sugar. It's grape water. So less is good. And especially when we get to the age of this room, 60 plus, the liver can't handle it. So less is good with alcohol and zero smoking if you want to live. And then monitoring your sugar is important. If you put your head in the sand, you won't know what your numbers are. And then we talked about plant-based diet, Mediterranean diet, regular exercise, reducing your stress, improving your sleep hygiene. Medications, sure, discuss with your physician what's right for you. And then if you get diagnosed, just have bite-sized things we discuss. Don't need to change. So, I like what Arnold Schwarzenegger did for himself. He did meat-free Monday for himself. He was a big bodybuilder. For him, cutting meat was hard. So he just did meat-free Monday. So just do bite-size. You can do one day of the week meat-free. You will get more comfortable. So I can do this recipe maybe on Wednesday too now. So, start bite-size. Don't get over, I can't do plant-based, And then the plant-based substitutes, be careful. The meat substitutes. They're pushing the meat look like burgers and nonsense. Process. It's all process. So this is the key take-home point, and repeat after me. If it's made in a plant, I won't eat it. Repeat, otherwise we're not going to give you the goodies to take home. So if it's come from a plant, I'll eat more. If it's made in a plant, I won't eat it. I want everyone to chant that. I didn't hear anything. Jen, make sure no one gets any goodies. Thank you for your time, and I'll leave it a few minutes for questions. Thank you. Thank you. Oh, I've got one more slide? Okay, sorry.
Some links for that.
Oh, questions? Yes, ma'am.
Can you get diabetes in your 80s?
Sure. Diabetes does not care for your age. You get this, you get diabetes. Slow down, you start taking steroids, you get diabetes. Any age, unfortunately. We're seeing in younger people. We're seeing in 15, 20 type 2 diabetes with everyone getting bigger. You go to a mall, you see younger kids, unfortunately, have a big, soda in their hand and a burger in the other hand. That's the meal. So we're seeing in younger population. Yes, sir.
So what is your view on Ozempic for?
So his question is, what's my view on Ozempic? Great class of drug, not for everyone. Just remember, how it works is by reducing all three things: your fat, your bone mass, and your muscle mass. So it's not just the fat mass which is going away, which is what people get all focused on. Oh, I lost 50 pounds in 6 months, phenomenal. Have you exercised during that time? Have you built your muscle mass? Have you walked 30 minutes? No. Oh, I lost weight. Minute you stop, now you have problem because the weight will go up in terms of fat and you lost some muscle mass and bone mass. So great class of drugs, has a beautiful role for a lot of things, but you got to combine with common sense.
And it comes back fast.
Yeah.
Here it is.
Well, what's the big difference between Ozempic and Mounjaro? Thank you.
So the big difference is the Mounjaro worked on 2 receptors, Ozempic worked on 1 receptor, but the essence is same. They work by making you full, quicker, slow your gut motility, and by doing that you don't feel like eating. You don't even want to look at food. So some people Mounjaro works a little bit more, they get 5-10% more weight loss. Some people it doesn't work. So everyone is different, everyone's receptors are different. If you reach a maximum on Ozempic with weight loss, you can talk to your physician, maybe Mounjaro if your insurance allows it. So that's another thing,
60 pounds on Manjaro.
Sure. No, I'm not, they are great drugs, but
when I stopped,
yeah, you gain it 100 back. And you not only you gain it 100 back, you lost, yeah. So, it's maybe you were more careful while you're losing weight, that you're changing your diet and you're exercising, yeah.
What about GLP-1?
Oh, that's the same thing.
Oh, okay.
So GLP-1 is a fancy name, they all belong to that class.
Okay.
Yeah.
I didn't know.
Yeah, no, that's his fancy name. They all belong to the same class.
Okay.
Ozempic, Mounjaro, Zepbound, Trulicity, those are the 4 common ones. They all work on GLP-1 receptors. Yes, ma'am.
I have a strange sleep pattern. I won't fall asleep till 5, 6 in the morning. And then I'll sleep for at least 3-4 hours. And then I'm up and I'm good. I'm fine for the day till the next day. Is that bad or is that okay for me?
So some people just need 3-4 hours of REM sleep to do well. 8 hours is a industry myth. Everyone is different. So if you're happy next day, you're not killing anyone by sleeping on the wheels, then you're good. Yeah, no, everyone has different sleep pattern. As long as you're not dragging yourself out of bed, yeah, that's perfect. Yeah, yeah.